This syndrome, Western differentiation, rheumatoid arthritis. RA is a chronic disease mainly characterized by inflammation of the lining or synovium of the joints. It is a systemic disease as it can affect other non-bone organs in the body, such as lung, heart, kidney, skin, bone marrow, nervous system, and eyes. It can lead to long-term joint damage, resulting in chronic pain, loss of function, and disability. RA progresses in three stages. The first stage is the swelling of the synovial lining, causing pain, warmth, stiffness, redness, and swelling around the joint. Second is the rapid division and growth of cells, or pannus, which causes the synovium to thicken. In the third stage, the inflamed cells release enzymes that may digest bone and cartilage, often causing the involved joint to lose its shape and alignment, more pain, and loss of movement. So we have here the images illustrating the joint degeneration in rheumatoid arthritis. So as you can see here, loss of cartilage would mean liver deficiency. Increase in synovial fluid would be dampness. Hypertrophy of pannus of the synovial membrane is dampness, phlegm. Pannus eroding the bone is kidney deficiency. Pannus extending over the articular surfaces would be phlegm. Total destruction of the articular surfaces, loss of cartilage, liver kidney deficiency, deformity of capsule by fibrosis is phlegm. RA can start in any joint, but it most commonly begins in the smaller joints of the fingers, hands, and wrists. Joint involvement is usually symmetrical. In general, more joint erosion indicates more severe disease activity. Other common physical symptoms include fatigue and stiffness, particularly in the morning and when sitting for long periods of time. Symptoms usually last more than 30 minutes. Typically, the longer the morning stiffness lasts, the more active the disease is. Rheumatoid nodules appear in approximately one-fifth of patients with RA. Typically found on the elbows, they can indicate more severe disease activity. Advanced stages include damage to cartilage, tendons, ligaments, and bone, which causes deformity and instability in the joints. The damage can lead to limited range of motion. RA is an autoimmune disease. The diagnostic marker of the disease is the anticyclic citrulinated peptide, anti-CCP, an antibody which is present in most patients with RA. Because this test is somewhat more specific for RA, it has replaced the rheumatoid factor, an antibody that is directed to regulate normal antibodies made by the body. In fact, approximately 20% of people with RA will have a negative rheumatoid factor test, and some people who do not have RA will test positive. The detection of anti-CCP has high specificity, 95 to 96%, but low sensitivity, 53 to 71%. A negative result does not rule out RA, whereas a positive result means a diagnosis of RA is very likely. In addition to antibody tests, diagnosis is confirmed by medical history, physical exam, lab tests, and x-rays. A physical examination will be looking for common features reported in RA, including joint swelling, joint tenderness, loss of motion in the joints, joint malalignment. The most commonly used tests are a complete blood count. Patients with RA often have a low red blood count, a high number of leukocytes, and an elevated platelet count. The ESR is raised in RA in approximately 60% of cases. CRP is often elevated, also indicating inflammation. X-rays can show the swelling of the soft tissues and the loss of bone density around the joints. As the disease progresses, X-rays can show small holes or erosions near the ends of bones and narrowing of the joint space due to loss of cartilage. MRI can detect early inflammation before it is visible on an X-ray and is particularly good at pinpointing synovitis, inflammation of the lining of the joint. Bone densitometry is an important imaging study for measuring bone density, used primarily to detect osteoporosis. Osteoporosis may be especially severe in people with RA due to joint immobilization, the inflammatory response itself, and the use of certain therapies, such as glucocorticoids, that may hasten bone loss. Thank you for your attention.